Hello and welcome back to our channel. In this video, we're going to discuss an EKG analysis of second-degree heart block, Mobitz Type 2. Second-degree heart block, Mobitz Type 2 is a type of heart block where there is a delay in the conduction of electrical signals from the atria to the ventricles. This type of heart block is considered to be more severe than Mobitz Type 1 because it can progress rapidly to complete heart block. We will discuss the difference between Mobitz Type 1 and Mobitz Type 2. It's important to note that Mobitz Type 2 heart block is a medical emergency and requires immediate attention. Without treatment, it can progress rapidly to complete heart block, which can be life-threatening. Patients with this condition may experience dizziness, fainting, or chest pain. Treatment for Mobitz Type 2 heart block usually involves the use of a pacemaker.
Being a student in healthcare can be tough. You have to juggle classes, exams, and assignments all while trying to maintain a social life. That's why we recommend Amazon Prime Student. With Amazon Prime Student, you get all the benefits of Amazon Prime, plus exclusive deals and discounts just for students. Order your textbooks and supplies with free one-day delivery. No need to worry about the high cost of textbooks anymore. Stream your favorite movies and TV shows, including Amazon Originals, with unlimited streaming. Listen to millions of songs on Amazon Music with no ads and unlimited skips. Get food delivered straight to your door with Grubhub for free. No need to waste time in long lines at your favorite restaurant. With Amazon Prime Student, through a partnership with Student Universe, you can get a 10% discount on flights and hotels to your favorite spring break getaway. And with Amazon Prime Student, you'll never miss a delivery. Get free one-day or same-day delivery on eligible items. Join Amazon Prime Student today and make your student life easier. Click on the link in the description below.
Here's a 6-step EKG analysis of Mobitz Type 2. In Mobitz Type 2, the diagnosis is characterized by a regular P-wave to QRS complex ratio, with occasional missing QRS complexes. In this example, the position of the dropped QRS complexes are noted. The dropping of the QRS complexes can occur in a pattern or can occur randomly. Step 1. Analyze the rhythm. Examine the rhythm to determine if it is regular or irregular. In Mobitz Type 2, there are two rhythms. There is an atrial rhythm which is determined by the P to P intervals, and a ventricular rhythm which is determined by the QRS complexes. The atrial rhythm is usually going to be regular. The ventricular rhythm, however, due to the dropped QRS complexes, will be irregular. Step 2. Determine the heart rate. There are two rates. We have an atrial rate and a ventricular rate. To determine the ventricular heart rate, we count the number of QRS complexes in the 6-second strip and multiplying by 10. In the 6-second strip, we have 5 QRS complexes, then we multiply this by 10 and we have 50 beats per minute for the ventricular rate. To determine the atrial rate, we count the number of P waves in the 6-second strip and multiply by 10. In the 6-second strip, we have 9 P waves, which we multiply by 10 and we get 90 beats per minute for the atrial rate. Step 3. Identify and characterize the P waves. Examine the P waves to ensure that they are regular and of normal morphology. In Mobitz Type 2, the P waves are usually normal, upright, and all look alike. Step 4. Measure the PR interval. Measure the PR interval, which is the time between the onset of the P wave and the onset of the QRS complex. In Mobitz Type 2, the PR interval may be prolonged but would almost always be constant. In this example, the PR interval is 4 small squares wide, then we multiply this by 0.04, which gives us 0.16 seconds for the PR interval. This is in contrast with Mobitz Type 1, wherein the PR interval would progressively become longer, until a QRS is dropped, then the cycle repeats itself. Step 5. Measure the QRS complex. Evaluate the QRS complex to determine if it is narrow or wide. In Mobitz Type 2, the QRS complexes may be narrow or wide, but can be wide due to bundle branch block or other conduction abnormalities. In this example, the QRS complex is around 3 small squares wide, multiplied by 0.04, we get 0.12 seconds for the QRS complex. So there you have it. In summary, second-degree heart block, Mobitz Type 2 is a type of heart block where there is a delay in the conduction of electrical signals from the atria to the ventricles. The EKG shows a pattern of dropped QRS complexes, a constant ratio between the number of P waves and the number of QRS complexes, and a consistent PR interval.
Thanks for watching. Subscribe and hit the like button so you can get the latest EKG analysis videos.